place here in Eastwood City. Before we proceed, I would like each one of you to introduce yourself one by one.
Hi there. My name is Rafael, or Jigger. My friends call me Jigger, and I am a organizational communication major from Salle University, Manila.
Hi, I'm Justin Luis Milano. You can call me Lynn. Also a major of organizational communication in Salle University.
Hi, I'm Frances Nicole Duran. My friends call me Nicole, and like my two friends, I'm also majoring in organizational communication.
We're thesis mates, and we're third year college
In De La Salle.
In Manila, right?
Yes.
Yeah. Now, very interestingly, I met you guys through a text or an email, right? I wonder why. How did you get my email address and my number?
Actually, because since our thesis requires us to look for organizations, we just found you online.
Okay.
Yeah.
So you're on your third year.
Yes, that's right.
So by next year you will start working on this thesis
Yes.
as a group.
Yeah.
As a group. Okay. So before we ask questions about the organization, what is the goal of what is the aim of the thesis?
Okay, the purpose of our thesis is that we need to contact a client organization, mainly a non-government organization, and assess the organizational communication issues in the organization, be it internal or external, and then also to supply interventions that can act as a solution to these potential issues.
And you're referring to my non-profit organization, the Beautiful Heart
Yes, the Beautiful
Foundation.
Heart, that's right.
Well, let me start by saying that we are a small organization. This was established way back in December 19, 2005, named after my mother's Spanish name, Corazon Belleza, which is in English. Corazon means heart, and Belleza means beautiful. So, in her honor, I established this foundation. So it's, I am the founder, and we have 7 major trusts. And in the acronym COURAGE, C would stand for care for the elderly, the sick, and the dying. O would stand for offer education and training. U, uplift people from poverty. R, restore the dignity of death and dying. A, accept donation and raise funds for the foundation. And G, gather people for common cause. And of course, the E would empower people towards good governance. So, very extensive. Now, when you say internal issues in relation to communication, it is an organization composed of family members and friends, and now as it becomes bigger, we are getting volunteers. Now, since this organization is not only registered in the Philippines, it's also registered in the US. In fact, it was adopted as an integral ministry of an independent Catholic organization, Holy Catholic Church International. So somehow, we have also the involvement of religious people in our foundation. And it's not only a foundation, we also have a mass media, a way to communicate and educate people through a television program that started in Davao in 2006, 7, 8, 9, and 10, 4 years in Davao. And the show is called The Beautiful Heart Show. Now, a little bit less than 2 years, we were lucky to get a slot in AMVT 15, Silicon Valley Community Media. And the same thing, we show our trust in the foundation. We present, of course, the advocacies in relation to health and wellness, arts and culture of the Filipinos, especially in the Philippines. And I think it's very effective tool to educate, to disseminate information, not only to our own members, but to our supporters as well. Over the last 5 years, we've been supported by a big 58-year-old foundation called Brothers Father Foundation, where we are given unlimited supplies of medicines and medical supplies. So I'm to the tune of millions of pesos now since 5 years ago. So that is a great blessing for us, because it used to be that I have to buy medicines here in the Philippines. Now all I need to do is communicate with them through email or phone call. Then he sent me a wish list. I fill it up. Of course, I have to complete from the beginning. I have to complete the requirements to qualify for those big donations. But communication-wise, it's really more of email, phone conversation. And after I get the donations, I need to also report. One way to report is to show the videos, the photos, and sometimes documentation of list of patients. That is communicating with our sponsors and donors. Now, for our annual meeting, we do it face to face. Sometimes communications are sent through email, and now with this social media, yeah, very effective tool also to communicate by Facebook chat and postings. Now, what is the medium? Of course, when you go to the far-flung depressed community, we talk in the local vernaculars, as I do the medical outreach program, meaning to say it's not just delivering free medicines, free consultation, but it is more of educating them in public health, preventive medicine, and also integrating not only Western medicine, but our own traditional alternative medicine as well. So that is how we push for healthcare, free healthcare for the poor. And I always emphasize environmental sanitation, environmental protection, the use of our own plants, herbs, fruits, vegetables, of course hygiene. So it becomes very effective because you talk in your own dialect. I speak different dialects, so I'm effective. I can speak, of course, our national language. I was born in Negros Occidental, so I know how to speak Ilonggo and Kamaya. Now, I grew up in Mindanao, Cotabato, so I know how to speak Cebuano, Ilonggo at the same time, and a little bit of Maguindanao. Now, so that is how I communicate, no? Through public health education. What else? With the volunteers, some are highly educated, some are registered nurses, some are doctor volunteers. So the medium of communication is English or our national language. With regards to external, right? We are being watched and admired because of what we have been doing over the last 10 years. I can vouch that practically I have reached maybe 60%, 70% of the islands, the total islands in the Philippines from north to south. So with the advent of Facebook, they can see clearly what we're doing because I upload videos. That's why I always have videos with me and pictures. So another way to communicate, they say that a picture, a photograph says 1,000 words, right? So any question about what I have discussed so far?
Okay, let's talk about your beneficiaries.
Oh well, the target really are the poorest of the poor.
If you say like the poor, the marginalized communities, where are they located? Or
well, in urban areas, say in Metro Manila, most of them are in the squatters area. What we call, they are informal settlers. Yeah. Now some are relocated in the suburban areas, like last Sunday I went to Talban, which is in Rizal. There are so many places in Rizal where they have relocation sites for these informal settlers. Areas where there are calamities, typhoons, flooding, very good place to outreach, medical outreach programs. In the rural areas, the same thing. You talk about the remotest of the barangays, Magdanao, in South Cotabato, in Bukidnon.
But majority, where are your beneficiaries? Are they in majority is in Quezon City or in?
It's so hard to tell now because we started in Mindanao. Now since I have office here since 2009, I get a lot of requests, medical mission partnership in Luzon areas. I was in the Ilocos region, Tarlac, Palawan. So it's so hard to really keep track. I would just presume, as I've said, maybe 60 to 70% of the islands in the Philippines I have visited. Yeah. In fact, there are in Facebook. I have different pages of Beautiful Heart Foundation, Palawan Outreach, or Negros Island Outreach, Mindanao. So I classify by islands, not by provinces.
All around the Philippines.
Yeah. There are only few islands that I have not visited. One or two. One is Bohol. I've never been to Bohol. Cebu. So those two islands in the Visayas. But since Luzon is just one big island, I've been to Palawan together with my family. Mindanao is one big island. Although I want to go to the islands of Sulu, that is something that will take place maybe the next year. So as I've said, maybe next year would be Bohol, Cebu. Yeah.
Yes, you mentioned that you educate the communities in the area regarding health and what the order is about. Do you have like communication materials that you use?
Normally it's more of the oral communication. But sometimes I bring DVDs because I have a projector. In some occasions, I do that, especially in the training of massage therapy, because that's part of our training program. So we have a video for that. Now our project, I call it From Rugs to Riches, where we are trained how to connect these rugs and make it beautiful doormats. So they follow through with videos, after videos.
So you don't have like pamphlets or brochures?
I don't really go for brochures because number one, it's very costly. I encourage them to have at least Facebook accounts so that whatever announcement, updates, they can just learn from the Facebook.
Who do you encourage?
The recipients and the volunteers.
Recipients and volunteers.
So everybody. I mean everybody. Even potential sponsors, donors.
Okay, let's talk about that. The donors, the volunteers, and the sponsors.
Right.
Who are they?
Well, locally, I don't find too many of them. As I've said, the big one who's really regularly donating is the Brothers Mother Foundation, and another one in California, MedShare, but it's more of medical supplies, not medicines. It used to be locally, some local pharmacies. In Davao, there is one, but now I don't really need to connect with them because as I've said, I have unlimited supply. I mean, I cannot even consume the one that's coming from the US. So what we really need right now is medicines and medical supplies. But I noticed that people are also starving. So they request for, feeding programs. And as people even want financial support to pay for their hospital bills, to buy for medicines, to pay for their tuition fee, which we don't have right now. We don't have funds. All we can really do is medical outreach programs, free medical consultation, free medicines for the poor. And hopefully, I would welcome, I would always encourage local sponsors, donors here, especially for feeding programs for financial support, and they don't really have to be part of the foundation. I work on it by collaboration. As one of the trust, gather people for a common cause. We can just gather. We as a Beautiful Heart Foundation, and you as a community organization, or a church organization, or a student organization, we can work together. What we have, we can share it with you. What you don't have, we can share it. Then we can come up with a big project that's effective, doable, you know. Say, I don't have funds for feeding, but you guys, as a student organization, you can raise money for the feeding, and we can go to a depressed community. You do the feeding, I'll do the medical consultation and distribution of medicine. So, or I don't have a dental staff, a group of organization that can bring in dentists. We can go together in one depressed area. And it's going to be not only medical mission, but medical dental mission. But that makes it very effective, very meaningful, because the idea of sharing, partnering, and
So how are these communities being informed if ever you're
normally a small organization will approach me in Facebook, or will text me, or will email me requesting for a medical mission because there's a need. So they do that, either text, email, or Facebook chat. And then I will set up how we can do it, and then they take responsibility of announcing it to the community. Of course, come campaign period, I'm sure there are so many politicians that would approach me, but I try to stay away from politically motivated, politically motivated medical outreach programs. Before election, of course, and it's part of the policy that it has to be coordinated with the local barangay. You have to get a permission, but it doesn't have to. As far as I'm concerned, we know that we're doing it right. Sometimes the asking for permission, approval takes time, and then there's a political color if you let them involved with the project. That's why I find church organization better. Since we are also religious organization somehow, my daughter is also faith-based organization, so we work in any kind of faith-based organizations. Of course, we are not saying that we will not work with government organizations, but I'm more comfortable with faith-based organizations. By the way, I'm not just a medical doctor, I'm an ordained deacon. So really, it's more of a holistic approach to healthcare, treating the body, the mind, and the soul. So that is a holistic approach.
Okay, go ahead.
Okay.
Yeah.
Okay. So, you said a while ago that you are open to like collaboration and stuff like that. And you also said that you partner up with small organizations. However, you're looking for more. How do you?
In fact, families.
Yeah.
Sometimes it's just a family group. Yeah.
So how do you communicate this to, for example, potential donors? Like, do they, if they see it, are they aware na it's for a collaboration, or what exactly?
Going back to what you were asking earlier.
Yeah. So basically, what I was trying to say is because you were telling us all these things and they're very interesting and stuff. But when I went to your website, I got kind of confused with like, although it's all there, like donate and stuff like that. I guess it would have been nice to hear that. So what I'm asking now po is, if ever someone goes to your website and sees that, are they aware po na this is what you're looking for?
Actually, the website, I do it myself. I'm not a professional. We are very cost effective.
By you.
Yeah, but there are different sections. I mean, if they want to donate, there's a section for.
Yeah, I saw that, but there's a lot
if they want to volunteer, there's also a sign up section. It's just that maybe it's not it's an old form of free webs that I follow, and And I came up with another website. Yeah, but it's not even updated. But nowadays, people don't even go to the websites. I noticed that they just go to the Facebook pages and accounts. It used to be very effective to disseminate information through websites, but I think with the Facebook now it's more effective. Yeah.
Definitely.
Yeah. So any more questions? Well, now with your organization, I'm just curious, or your course. This is communication organization. So what is the idea to find of being able in your thesis being able to assist our organization in terms of communication? Yeah, well, I would welcome that. I mean, I know. Like I said, our website is designed by me. I'm not even an IT expert. You know, I would welcome people to help us update, improve the website.
Yes.
Now,
And other forms of communication.
yeah, like the pamphlets. The reason I don't go for pamphlets is because it's costly, and maybe for donors that's very useful. But for an ordinary poor, recipient, they don't even care about these things. What's important to them is to get free consultation and free medicine or free livelihood training. Yeah, but that is something that if right now I'm pushing for poor communities to avail of my children's used books. I'm sending it to Mindanao, my own medical books. Our own personal collections of books. I'm sharing it to poor communities. But how I wish, one of my old 5-year-old computer set, I'm also donating it in Cotabato after hearing that, in a public school, they have only 1 or 2 computers, and even books. So this is something, for a university organization. Think of sharing, old books, especially in far-flung areas like Mindanao. I know that part that in terms of computer literacy, they're way behind. Yeah. So we're lucky that most of the teachers and even some of the recipients and volunteers, they have Facebook accounts. But there's more information, I think, that you can gather if you have a computer set, a desktop or a laptop. But for now, I guess what they see, what they watch, and what we advocate on Facebook, that's good enough. It inspires them. It gives them hope that somehow this is a small organization like the Beautiful Heart Foundation trying to reach out to them. Yeah, and I hope the idea is if we can really collaborate. Yeah, we can do healthcare. Some other organizations can do educational campaign. Other organizations can do livelihood training. But we can go together in one area. More fun.
But for our course, organizational communication, usually our course is confused with marketing and advertising.
That's why I thought you're
we're not on that aspect. For organizational communication, we focus more on the development of the organization because marketing and advertising.
So let's say like this one, more than 10-year organization. I know there's so much need for improvement. Yes. Talking about reaching out, Beautiful Heart Foundation is not only reaching out in the Philippines. I've been to Africa where the language is French in Cameroon. So, but Mexico, maybe by next year I have to do outreach in Mexico. So I have encountered communication problems. That language barrier, especially in a French-speaking country like Cameroon, or maybe in Mexico, which is a Spanish-speaking country. So these are also communication issues.